Hi, I'm Mackenzie. I'm your student nurse from Newman University. I have a doctor's order to put in a Foley catheter today and get a sterile urine specimen. Could I just have you verify your name and birth date? Sue Quinn, 7/21/1951. And do you have any allergies? Levofloxacin and strawberries. Now, are you allergic to any iodine or shellfish? No? Okay. Just gonna go ahead and raise your bed up. Back. And we're just going to put your legs up like this into a diamond. There we go. Okay. I'll set this over here. I won't need this right now. Is it okay if I put this biohazard bag on the other side of you? Okay. And since there's already a Chuck's pad underneath her, I would not have to put one underneath, but if there wasn't, I would have had to bring one in with me and put it underneath just in case. And I would check the expiration date on the package and make sure that everything is inside of it that should be inside of it. It's not expired. Away. I'm just gonna hand hygiene. And if I was not able to get to these gloves, I would ask someone else to bring me sterile gloves, but for this, I'm just going to just a little bit, and I can touch just the corners. This out. I'm going to put this under the patient, shiny side down. Okay. gonna avoid touching the lip on this or the inside of the specimen collection lid. Put this in the trash can. I'm gonna make sure this has 10 milliliters in it still, because that is what this specifies. Okay, and I'm gonna go ahead and clean. I'm gonna contaminate this hand to help me hold open, and I'm gonna start with the side opposite of me. And then the side closest to me. And then I will do down the middle. Going to ensure that this has enough lubrication on it. Okay, and I'm going to have the patient take a deep breath in, and when they take a deep breath out, I will insert it. And I go 2 to 3 inches until I see urine, and once I see urine, I advance another inch to ensure that it is in the bladder. And then I will hold this in place with my clean fingers, and I will inflate the balloon. Okay, and I will just make sure that that stays in place, okay? Okay, now we'll dispose of this. Okay, and I will put new gloves on to take the bag out since I have iodine on these. And hygiene. I'll get my tape to secure this in place. Actually, I'm going to wait to do that until after I get this. Okay. Let me set this over here. And there's a bunch of different things you could use in order to secure the catheter in place. There's a leg band that you could put around and it would hold this, and then there's another thing that separates these and holds them in place, or you could also just use tape. And when you use tape, it's good to make sure it wraps around the tubing and then tape it. Okay, and that seems secure, so I'm gonna hang the bag on the hook underneath the bed that's meant for it. Make sure the tubing isn't twisted or kinked at all. Okay, then I will do that. And I'm going to put new gloves on just because I do have iodine on these ones again. And I will collect my sterile urine specimen. For this, I will need an alcohol wipe in order to clean the port on the catheter, and I will need a 10 milliliter syringe. There. Okay. I'm going to clean the port for 15 seconds. Make sure to get it clean so that I do not contaminate the catheter. Okay. And then I'm going to take my syringe, and of course I'd wait for that to dry. Okay. I go straight onto there and twist. Okay. And then I draw 10 milliliters of urine, because that is what is needed for this collection. Untwist. And before that, I would have clamped off the tubing down there. And then I'd put this in here very slowly, making sure not to touch the lid or the lip of the cup. Okay, and then I dispose of this in the biohazard bag. And I took these off because they are contaminated. I'm just going to carefully put that on there, making sure not to touch it onto anything. And I'd write on here the patient's name, the patient's date of birth, the date, my initials, the type of specimen, and the time it was collected. And I would send that off to lab. I'm just going to go ahead and clean this up. And I would put that, all of that, in the trash because it is not contaminated with anything that I could be concerned with. And so now we have an order to take the Foley catheter out. And I would have already disposed of the biohazard bag, but I'm just going to use that for this to take it out as well. And so, just get this out of the way. And that would have went in the trash too. Okay, so we have the order to take it out. I'm going to need a 10 milliliter syringe to deflate the balloon and a washcloth. I'm gonna set the washcloth here. Okay. And I do not need to alcohol wipe this because it is not anything that needs to be sterile. Okay. Put that on there. I'm going to attach this. Okay. I'm going to hold this in place while I deflate. And you just aspirate the syringe a little and then it will fill on its own. It just takes a little while. And once this stops filling, you'd make sure that it still has the 10 milliliters in it to ensure that the balloon fully deflated before you pull it out. And you wouldn't pull back on the syringe anymore because you do not want the balloon to be wrinkled, because that is not helpful for when you pull it out because it can cause more pain. Okay, I have the 10 milliliters. So I'm going to have them take a deep breath. I'm going to hold it like this. And I'm just going to have them take a deep breath and I will just pull it out. And then I will dispose of all of this in the biohazard here. So I'll dispose of all of this in here. And I will put it back here. And then I will put their legs down and help them back into a comfortable position. And I would have also checked the area for redness or irritation or anything to ensure that there wasn't an infection beforehand. And I would document everything. And that's it.